Okay, I think we'll just get started. So before I pass it on to Ryan, I'm just going to say a couple of words about BIST. And what BIST is doing amidst this COVID-19 crisis. So I just want to, hope that everyone who's joining us tonight is safe, and I hope you and your families are staying safe and healthy. I do want to let everybody know that the BIST office, unfortunately, like everywhere else in the city, is now closed and has been closed. However, all our staff are continuing to work. So please, if there's any resources you need, whether it be help getting food, medications, or any other resources that you might want to access, you can still give the BIST office a call. It's 416-830-1485, or you can email us at info@bist.ca. The other piece with that number, it's operating as an information line as it always does, but it's also operating as a warm line. So if you are just feeling socially isolated or just want to have a chat with somebody, please also reach out and give us a call. We're more than happy just to chat. We know it's a trying time for everybody, and we're happy just to have a conversation. So please feel free to use that number for that as well. And the one more thing that we're doing, all our programs have moved virtually, so our support groups are still running online. Our webinars are running online, so please continue to reach out and access us. On Wednesday at 6:30, we'll be doing a webinar specifically to COVID-19 and specifically talking about whatever the current recommendations of the day are. We know that they're changing daily, to talk about, the recommendations from public health, but also again, just to address the anxiety that can come along with a crisis like this, along with social isolation. So we'll talk about some tips and some strategies to help cope with all the changes that are happening at this time. So if you want to join that webinar, again, you can call us or email at info@bist.ca. We'll also have the link up to join the webinar on our website and all our social media feeds. So with that, I'm going to pass it on to Ryan, who is our Programs and Services Coordinator. Take it away, Ryan.
Thank you, Melissa, and welcome everyone to our fourth event in our 5-week ABI info series. Before I get into a bit of the introductions here, I quickly want to get everyone oriented to the platform. It's definitely new for everyone, so let's just take a very quick minute to sort of like look around what you have at the bottom of your screen. Looks like somebody's already in the chat room, so let's begin there. Thank you, Diana. There is a chat room. If you want to join the discussion with everyone else listening, please feel free to do so. The panelists will not be checking it. Melissa and myself will be. So anything you do want to ask, please try and save for the other function, the Q&A, which is just to the left of the chat. Put all your questions in there and we'll definitely get them to Laura, if not during the session, at the very end. I think that should be everything. We are going to be recording for anyone who came late. We'll be sending this information out to you in the next week or so and making it available for you. If you weren't taking notes or anything, don't worry about it. But for tonight, we have the pleasure of hearing from one of BIST's own on community healthcare and government resources, Laura Bellon. Very exciting. Before we get into the presentation, however, I wanted to thank our corporate platinum sponsor, PIA Law, for helping us put on this series throughout March. It really is so incredible that we can get these professionals together to present to our members. And now more so than ever, we are so grateful that we can continue to keep our community active with your support. So thank you, PIA Law. To introduce our speaker, let me introduce Laura Fitzgerald Husek. Laura completed her undergraduate degree at the University of Toronto in Ethics, Society and Law, and International Relations. She obtained her Juris Doctor and Master of Public Administration at Queen's University and also completed the International Business Law program at the Bader International Study Centre in England and was called to the bar in 2013. Laura joined Oatley Vigman after practicing insurance defense at a leading national firm. The experience of representing many of Canada's largest insurers has provided Laura with valuable insight into personal injury claims, allowing her to better serve her clients. Laura's practice focuses solely on personal injury law, including motor vehicle accidents, accident benefits, medical malpractice, occupiers liability, and product liability cases. For Laura, the most rewarding aspect of her work is helping clients achieve the best possible outcomes. When she's not practicing personal injury, she enjoys traveling, spending time outdoors, and as an amateur scuba diver. Very cool. So, welcome, Laura.
Thank you for that intro, Ryan. I think I'll have to update my my interest section. I've been really into cooking and organizing at home for the last week or so. So on behalf of PIA, thank you for letting us continue sponsoring these wonderful programs. I now have the privilege of introducing Laura. So Laura Bellon is the Transitional Support Coordinator at the Brain Injury Society of Toronto, and she's been in that position since the position first received funding in 2018. Laura works with Brain Injury Ontario and has been doing so for over 15 years in the private and public sector systems, serving both youth and adults. She's collaborated with various agencies to support at-risk individuals to obtain needed resources in their respective communities. Laura's focus continues to be the goal of promoting safe, functional, client-driven care for all individuals living with ABI. And I'll turn the floor over to Laura now.
Hi. Hi, everyone. I'm just going to share my screen so that we can all see the slides for tonight. So this is the presentation. It's a presentation on community healthcare and financial resources. And this is going to be quite a bit of information. So we are, like we said earlier, going to provide the slides. If there are any questions, please feel free to ask. And we'll try our best to answer them as we go along. Ryan there will monitor and let me know. And we'll try to record anything that questions people might have if we need to get further information for you. Okay, so what do I do? So I'm a transitional support coordinator, and what that is a person who's basically helping people with brain injury or cognitive issues in this role with applications for the Ontario Disability Support Program. Okay, it's a pilot project that started in Durham at BIAT, the Brain Injury Association of Durham, in 2009. And in February, we applied with a GROW grant from the Ontario Trillium Foundation and started the program in February 2018. So we get to have a worker here at BIST, which is myself, who's looking to support our brain injured community access the financial supports they need. So what we do is we offer help with filling out applications, with contacting physicians if they're needed, mental health professionals, legal aid, other sources in the community that aren't necessarily provided by the OW office, just they're not able to, and we provide those wraparound supports. Okay, so that's what the position does, and that's what I do on a weekly basis with clients in the Toronto area. Okay, and this is a grant, so it is a GROW grant. The funding is provided by the Ontario Trillium Foundation. We're lucky to have this operating, and we're in the third year for this particular grant. Okay, so really what this webinar is looking at quite a number of resources that are in around our community. Some of them will be provincial. Some of them, for the purposes of tonight, are going to be related to Toronto, and I'll use a lot of different Toronto sources of information. However, a lot of the links or where you would get numbers will also have connections to other programs throughout the province. Okay, so the first look is at our community resources. And some of the questions that always pop up are, where can I go to get help with housing, with food, with taxes, And there are quite a number of resources out there. Sometimes they're hard to hunt down, and sometimes the sources aren't easily, they're not easy to navigate. So what I've done is I've pulled a few of the resources out here for this presentation that people can either call or go online for, that are good starting points, and sources that allow people to speak to someone live if they need it to help them navigate. Okay, so like I said, by phone and online, these are just some examples, and we'll go in depth on a few of the service resources in the community. One for Ontario is 211. They do have a call line. They're accessible online. They have an email, so you really can get them on any type of mode that you have available to you. There are great resources to look up any type of provision that you need, and we'll look at what their website, we'll look at what their webpage is in a few slides. Another resource, if we're looking in the community, is ConnexOntario, and this is provincial. Again, they have a live person available if you call in, and I've used this one a lot, especially for mental health resources. They do look at addictions as well. It's a main component. When you call in, you can specify whether you're a user, a client, whether you are a service provider, and they can help you navigate the system. They also let you, they also can gather information for you based on the location, based on age or the demographics of the population you're serving, which is really neat. And they can send to you either through email, or if you need to request by mail, a list of the supports that you just asked for. They're really good at compiling those for you. I've also put a few other bits of information. On one side, I have Ask. It's a Etobicoke resource. It's a drop-in, but they also have an in-person that's available that you can go to, and they can help you with searches. Of course, right now, with COVID-19, a lot of the in-person resources are on hold, and most supports are being accessed by telephone or online. I put in online, if you're in a different area of the province, something from Peel. Most cities or most metropolitan areas will have a resource list or BIST attached to their city. So you can always look at that. And of course, some other things related to mental health and healthcare in general is Healthline. I put the Toronto number, but we can look at different supports through that resource base later on. Another one with mental health supports is Mind Your Mind, and we'll look at that as well. So just to call up the visuals for these places and to help people get accustomed to what they're looking at and what I'm talking about, I've put up the slide for 211 Toronto. If you're going on today or last week or probably for the next couple weeks, most sites will flash the COVID-19 picture for you. And that's to let you know that there may be service delays, slowdowns with calls. Also, some of the providers, they're 211 and ConnexOntario is pretty much up to date on what service providers are closed or open. However, of course, they may have some discrepancies as information's coming in on a daily basis. However, they do encourage you to call back if you hit a block with a resource, and call them back, and they'll provide some more information or more numbers or more contacts. So this is what the page looks like. You would go on, in the find service section, it asks you to enter a search word. Again, I'm going to use Toronto as a starting point, and look at what we could, what you can see. This is Ontario 211. It's the same thing when you go on the page. I specified for Toronto. If you want provincial, you can go into different areas. If you don't know how to refine a search, that's fine. You can look at topics and walk through the website that way. So you see here, if you wanted community programs or healthcare, housing information, food, it's listed there. If you get stuck, there's live chat you can call, and someone will help you out. A little bit further down on this page, there's a section that says try the search help tool. I find that particular tool a little bit confusing. You put in one answer and then it's another pop-up and it goes to another pop-up and so on and so forth. So it can become a little bit confusing. So I like to do just a plain search. So if I wanted to put in brain injury programs or supports, you would see a list come up for all of the ones in the province. Okay, so that's pretty helpful. The other one I talked about earlier was ConnexOntario. This is, and it is a great one. It has the ability to call, chat, email, and it has a directory as well. So if you're not wanting to talk specifically to someone or wait, you can search yourself through their directory. Anytime I have called and I've given specifics, they've been really good at giving me the wait times for beds in certain facilities, whether it be 2 weeks, 6 weeks, 1 month, whether different areas have open beds, if clients are willing to travel, things like that. So that's another great resource. And currently with COVID-19, they are updating regularly as information is coming in. So they'll be able to give you up-to-date information. Mind Your Mind is a connection, and it is a resource. It is online, and it's there for people to access when they don't necessarily have available a social worker or therapist that's already set up for them. And this is one that has a lot of different resources in one space as well. There are tools that people can use, whether it's related to learning about mental health or assessing, or different supports for, say, anxiety or management of some moods or feelings. It also gives a lot of different numbers, and I wanted to highlight that. So I pulled out some of the recent numbers that they're listing. So if you were wanting to talk to someone, they again list a few of the resources, some numbers, some are links if you're on the web page that you can go to. There's ones that are chats, things like that. The list goes down and it does provide more information for Ontario, and then it goes into North America. So there are some more broad based information sources there. It's neat if you have the time or are able to move around the website and look at it and get familiar with it. Some of the sources and resources are quite good for different groups of people. So there's one for professionals, ones that are in school, whether it be med school, nursing in that. There's a specific resource for them. There's one for adult, there's lots for adults, but one for adolescents, in the school age area, teenagers or young adults that that can access group supports there. So that's a neat one to see. And then obviously it looks at I'm in crisis. And on the site, it walks you through what a crisis is and what it looked like physiologically, as well as statements that people might be making. And these are some of the crisis lines that they provide, and this is pretty up-to-date information from the last couple of days. Okay, so those are the numbers. They're available to you if you need to use it for yourself or for someone you're supporting. Okay, on the side, it has some other highlighted bits of information. So this one, if you're able to peruse it and at a future date, it's a good one to go to. Okay, some of the other resources that are needed right now and ones that are on everyone's mind, aside from COVID-19, is tax season. This happens a lot where people aren't sure where to go. And those that are strapped financially and don't necessarily have the funds to dedicate to going to an accountant, the government provides a number of free tax clinics that are offering the support throughout the province, throughout Canada actually. So this is one of them, one that's highlighted a lot sometimes in the Greater Toronto area. They do usually run a wait list, and it is free tax support. They have some different language supports there, as well as they can look at different tax years if you have a few. However, it does look at the, there is a limit on who can access the free support, and it's based by their income and eligibility criteria. Okay, so so look at that, and it gives it there, but you can call in and receive the support. This is the government website, and in the area that's, when I was creating the picture link, I had clicked on the wording for find a tax clinic in your area. So if you look at the purple lettering, if you can see the purple come out, that's great. If not, this is where you would click on, and it's actually good. You can go in, and I think it's the next slide, where you can pick your province, pick your city, and then your current tax year. So if there are several that you need to do, this is a good resource. Not all places that are offering clinic support have the volunteers available that can do a number of previous years. They might not even have the not technology, but the program for it. They might only have the current tax year program or the previous year. So you got to look at that. That being said, with the changes taking place with the COVID-19 and a lot of the different clinics that are operating closing to protect the workers and the health and safety of the individuals coming in, it would be a good idea right now to check with providers if they're still open and providing services. On Wednesday of this week, BIST is, like Melissa said, running a webinar that's looking at all the different changes and resources that would be current up to that date that are offered. But just to note with what I'm doing tonight that there may be some service delays. With taxes, the government has allowed people to, they've extended the deadline. So instead of it being in April, the deadline is now in June. So that allows people to stay home, stay healthy, self-isolate if needed, practice social distancing, and then bring in their taxes when it's safe to do so and have them completed. They've also made a few other changes with e-signatures and that, so you're not going in to sign in some circumstances. But I just wanted to make sure that people with the resources I'm mentioning are checking before they show up in a specific place, just in case they aren't physically open. That's why I'm focusing on calls and online resources. Okay. If people in the moment are wanting to access what the government's economic response plan is, I've provided the link there on this page, on this slide, and you can go through the all the different new resources that the government is opening up. Some start in April, some start in May, some require the previous tax years, the previous taxes to be done for the individual in order to access it. Okay, but there's quite a number of things that they're providing in order to keep the economy going. Okay, so that's there. I provided the link. The other thing that comes up too, and when talking to clients that I'm supporting in the community, are some of the numbers that they may need to access right now. So Telehealth Ontario, that's the number there. That's what people are calling if they feel they have signs and wondering whether they should be tested. The last couple of weeks, so many changes have been made to where to go, who to call. So currently it's, the best thing to do is to call Telehealth Ontario, and they'll help direct you. There's self-assessment tools, but if you're unsure, calling them, they'll direct you. There are a number of assessment centers set up, and I know on Wednesday they'll go over quite a bit of this. But a thing to note, and just to make sure that people aren't shying away if they feel they need to be tested, is that the assessment centers aren't requiring OHIP. So you don't need to, if you don't have it, if it's expired and you haven't renewed it, it's not a requirement. They want people to test and make sure that they're healthy. Okay. I've included a few of the local public health numbers. A lot of the times the news agencies or the information on the government website says contact your local public health network. So I've included a few around the area. If you need further ones, whether you're supporting a client in a different part of the province or for a family member or such, or for yourself, depending on where you're tuning in from, I've also provided the link for the government of Ontario and all the different locations, so you can scroll through to your area. That would be your local public health number. Okay. What we can do at BIST for people is to help them with these calls. So if you're having trouble and you're not sure what to do, and you need the help and you don't know what your number is, that's okay. Ask us and we'll go on the locator with your postal code and figure out where you need to call. And if you need support with a call, because maybe it's a little daunting or a little you're a little nervous about it, maybe that's a support that we can provide. Okay, so those are there for you, quick and easy access. Okay, so looking at the healthcare proponent, one of the sections I do, and something that I support a lot of the clients with in the community, is looking up different healthcare resources. A lot of people in this community require different types of specialists, doctors and such, and we look at different resources people can find. Okay. There are some free resources. There are access to social workers and psychotherapists sometimes that are free, depending on the community and depending on where they're connected to. So I want to help walk people through that, especially if they don't have the funds through any type of insurance benefits to access it. Okay. So these are some of the common resources that someone would look if you're trying to find a doctor. There's the College of Physicians and Surgeons. Sometimes I look at that to see a doctor in an area. I look at that if someone's wanting a physician that speaks a specific language. You can also look how they are and what standing they have. So are they a doctor or a physician operating in good standing? What hospitals are they affiliated with? That might be important for some people. A lot of people may not be. It's okay, depending on the medical needs of the client, whether they've had previous surgeries or complicated health needs. Okay, the hospital websites are always there. They're little difficult to navigate unless you're looking for something very specific. So you can always go into the hospital websites and put in neurology or you know, a neuro-ophthalmologist and see if they have a department that specializes in that. And then you can look to see if there's specific referrals that a doctor may need to sign or fill out. Okay. Health Links is also another one, and we'll look at the web pages in a moment. And Healthline. Okay, these are basically databases that provide all the information for different healthcare providers in the area. Okay, so they list nonprofits, they list some people that are physios, they list community groups, support groups that are specific to that area, usually with the local, the LHINs, the local integrated health networks. Okay. So if we look, there's what the College of Physician and Surgeon website would show up as. I always like putting in an advanced search, but if you want to start off with a quick search, go ahead. You can select your town. You can also look up by postal code or the name of a doctor if someone said, oh, Dr. So-and-so practices this, and you can search and find out whether they do or not. Okay, so that's helpful. This is the Toronto Central Health Line. You can, and I picked Toronto just because of where BIST is located, and you can see there's quite a number of areas around it. But on each site also has some resources and drop-down menus of all the different types of topics that you might want to access. Okay, and in there they will list the name, number, website, email address, hours of operation, and such. I'm not sure at this point whether they would be up to date or have the ability right now to update all their resource lists. So 211 is during this time anyway the good place to go, and someone can do those searches for you. Okay. Again, I've gone into the Toronto area for this, but I wanted to highlight this because if I put in a specific type of search, these are the types of things that I'll get. One of the supports, and if I go back in the slides, if I go back in the services and I wanted to look at healthcare facilities or different centers, the LHINs lists and operates a number of community health centers that provide a lot of supports besides a family physician. So people that need diabetic care, foot care, social work, sometimes they have lactation consultations for people. Sometimes they have senior supports, child wellness supports. These are the places to look at, the community health centers. And for example, I'm using the Black Creek one. They'll list on their websites all the different providers that a patient to their area would be able to access. It's done by geographic location. So if you look up community health centers in your area and are requiring a lot more wraparound supports, this is a place to go. I find that for the clients that I'm supporting, with cognitive issues or maybe memory issues, setting them up with a physician in these settings is helpful. One, I've found that the appointment times are about half an hour, which is great for some of the high needs of our clients. Two, they also get to access the other supports. So a lot of times they'll see the family physician, and then they'll be set up with a social worker or someone else in the care team. And that comes without a cost to them because it's covered by the umbrella of supports at that community health center. The other thing is, a lot of times they're not penalized for missing an appointment, and that seems to be something that happens a lot with the clients that I'm supporting. So if that's an issue because of memory or because of just the person's health, they get sick often, fatigue, and appointments are an issue, it might be a good idea to look at this. The other portion with the community health centers is that sometimes in the area there is a wait list, but it's worth it to call. It is an application intake process. They do look at the needs of the individual, whether they're coming in with a spouse, partner, children, whether they're just themselves, single patient. They also look at whether the person's medical needs are if it's necessary to support them right away, or whether they can wait a little longer. Sometimes you get lucky and you get in right away, you do the intake and you're seen. So it depends on the needs of the patient, but I find them giving a lot more. Okay, so if there's any questions that come up regarding any of the resources in the community for healthcare right now, let me know. If there's other numbers that people were wondering about or specific supports, let me know, and I'll see if I have an answer right now or I could look into for you. My role as transitional support coordinator, aside from setting up our clients in the community that identify with brain injury, with the ABI network and such, a lot of it has to do with the main part of the job is getting their ODSP application completed. So these are some of the financial supports that are available government-wise for people, and we'll touch upon them briefly in this portion of the webinar, how to access them, and what you need to do to fill them out and what you get from them. Currently, with like I said before, with the economic response plan that the government's put out, there will be there are some changes on how it's delivered. So for example, with Ontario Works and ODSP, a lot of the spaces are not open currently. You're calling in and you're being redirected to 3 main areas, at least for the Toronto region, for supports, and it's call-in as opposed to appointments. So if you do have clients, or if you're listening and you are someone who receives OW or ODSP, right now they're not allowing people to walk in, so maybe just don't show up that way. Just give them a call first. You also might not be able to access your worker, so I just want to make people aware that the workers have been deployed to different areas, so that kind of makes it a little bit difficult this time. However, some of the checks in place, they are concerned about people being able to access funds to pay for housing in that. So rest assured right now, especially in Toronto and some parts of the province, there's regulations that have been put in place so people aren't losing housing, so they're not being evicted. Currently, for the next 60 days, I believe it is, that the landlord and tenant board won't evict anyone, so that people have an opportunity to stay home, stay healthy, look after who they need to. Okay. So there's some slight changes on access, but this is the general how-to. Okay. So Ontario Works, we'll look at how to go about calling them. Okay. It is part of the Ministry of Children, Community and Social Services. So this is the main office locator. And this is where we would look to contacting or finding the one in your area. It is done by postal code. Okay. So you can pop it in and then you would see where it is. In Toronto, there happens to be many, many, many OW offices, but other areas they may have one or two. So it depends. Okay. The ways to apply are slightly different, like I said. So right now, your main way to do this is on the phone. In person is not going to happen, in Toronto at least, and online. I always find, though, these are the numbers and the web-based access if you need it. I always find that calling in is one of the best supports. There are quite a number of circumstances that are taken into account when you're talking to a live person. And sometimes when you go online to do it, it'll direct you just back to, you may be eligible, please call in. So may want to skip the online part and just go straight to the calling in the person. But that's up to you. This is what the locator will look like. So I picked one specific to our postal code at BIST, and this will give you the OW, the Willowdale ODSP office, and the one for the children supports. Okay. Okay. So OW, Ontario Works, is your first step for financial supports, and basically emergency financial supports. The main part of my job is getting people onto ODSP. And part of that is calling, figuring out if you're eligible. And the application process, 9 times out of 10, is you call ODSP, they direct you back to OW. They do want to make sure you have funds coming in right away, just in case you don't. A lot of the times people are placed on Ontario Works right away because of the need. And a portion of persons don't qualify financially for Ontario Works. However, they do qualify for ODSP. So when I'm supporting a person with calling, I'm always saying our end goal is to look to have them receive the application for Ontario Disability Support Program. So the person in the Ontario Works office doesn't lose sight of that. And they've been really good. So we call in, we ask for the assessment. Once an assessment takes place, they're given, their name is kept in the system, a number is generated for them, a referral number and a PIN number, and then we get the application. So those are the steps I talked about. We call in. The first part is determine the financial eligibility. They have a calculation. It's different for single individuals as opposed to couples, as opposed to persons with children. And there's a few different factors that come into play depending on the type of disability or other needs that need to be met based on, say, children and the age of children. Okay. The next part is determining if you meet the definition of a disability, and that's where the package comes in. So again, I provided the link, and the actual application process, again, it works by postal code. So you have to contact the one that's related to your area. It won't work to call a different area. They may direct you to the correct one, or they may say this is not the right one, you need to call your own office. there again, I've just given the supports. So this is what you would see. Sometimes if you have to check the postal code, you can see it there, and that's all the areas that will be directed to that one ODSP office. So that's good, that's there. The process and timeline, you're given 90 days as soon as the application is released. And that's because it's given a specific reference number that's associated with that individual, with their social insurance number, their name, birth date, and address. And it's always from the date that referral number has been generated, and it stays open for 90 days. You can call in and request an extension. There's not an issue with that. They're very understanding that sometimes it takes a while to coordinate efforts with physicians or coordinate efforts with certain therapists in the community. It does lapse. They generally don't go over the year mark with it. They'll say, just, don't worry about this application, let it lapse for a couple of weeks and call back in to request a new document. You can't use someone else's old photocopy document and have it blank and try to fill in your own. It won't work. It's related to a specific generated number. Okay. Once it's in, you can get it in before the 90 days. If you're able to, if there's a physician willing to sign it off. And then after that, they have a while to respond. I've had clients have responses with approvals in 2 weeks. I've had them in a month. I've had clients have a response back in 2 months, 3 months. So it's really something where you want to get on as soon as possible, because that might mean some more financial assistance for someone who requires it. Okay. If the application is open and submitted and denied, please follow through with the internal review process. You have 30 days. It's a one-page document you sign with the reason, and it allows someone else to review the information at the office, at the disability adjudication office, for a chance to overturn that decision. If that is denied, there's the final step, which is going to a social benefits tribunal. And I always encourage people to follow through with that step because when they do go to social benefits tribunal, right now the wait times are long. They were shorter, I'd say, a year ago. Right now it's taking in some places 6 to 12 months for this. However, if the application is approved, the person is awarded retro payments from the date that they originally submitted the application. So if they need the financial supports, it's there for them. Okay, and the tribunal gives you the time frame of 60 business days. Right now, though, with COVID-19, a lot of the tribunal dates have been postponed, stopped, and they are waiting to determine when they're going to set the new dates in the future. So there is a little bit of a waiting time. If you have one application in and there's a change to the medical needs, or there's something that's not listed on the original application, I would encourage you to speak to your worker, whether it's at the Ontario Works office or ODSP office that's generated that first application, and speak to them regarding releasing a second application to you so that you can document with the physician the changes, so that you can get that in too. There's lots of people that may have multiple applications in at the same time for various changes in medical needs. So that's just something to note. I wanted to provide the rights and responsibilities just to show you that there is a list of things that people can access. with ODSP. Okay, so it's there. It's also available on their website. This is something you can download and review. It talks about the drug coverage. It talks about things like rapid reinstatement. So if you were awarded ODSP and you're determined or deemed a person with a disability by their definition, and say that there's some funds that you came into, there is some changes where if you are not financially eligible at the time, however, then need it again, they don't make you go through the application process. That stays with the disability adjudication unit, and then you speak to the worker and they would reinstate the financial portion. Okay, so that's nice to know too, that people don't have to go in, keep on applying if they've already been approved. Okay. This is just a general budget. There are, and this is just taken right out of the Act, and set up into a chart to look at what someone would receive. There's differences depending on whether someone is a single recipient, someone is applying with a partner or as a couple, whether someone's applying with dependent children under certain ages too. So those are some ideas of the funding that someone would receive. That is changed if they receive CPP or CPP disability, only because the province sees the federal government as giving the supports first, and then they supplement the rest. So it always goes CPP, CPP disability, those federal amounts, WSIB or another private insurance payout, and then ODSP would top up the rest. Okay, just so people are aware. We're with the Canadian Pension Plan, CPP. There's two portions. So if you are at a certain age, 65, you can apply. If you're below 65 and you're not able to work because of a disability, that's when you would make application for CPP disability benefits, okay? And they take into account the time that you have worked in Canada and contributed. They also take into account for people that have been raising children. So you would indicate the child, their social insurance number, and the number of years that you were providing caregiving support to them, because they recognize that some people may not have been in the workforce during that time, however, have contributed to raising children, and that's considered work. So that's part of the benefit, and I encourage people that indicate that I haven't worked a lot, I took time off to raise children, then I went back for a bit, then I had my disability. I always encourage them to apply. Okay. There is a definition. It is very different from the Ontario definition for ODSP. So you have to meet the federal government's criteria, and I've put in the definition there. However, if you are approved for the CPP disability, you're automatically eligible from a disability standpoint with ODSP. So if someone already has CPP disability, you can call the ODSP office and say, I am already receiving CPP disability. Then you wouldn't have to go through the application process. You wouldn't have to get it signed by a doctor. All you would have to do is go through the financial calculator with them, okay, to determine how much you could receive, okay. This is sort of the numbers that are coming up from the government, okay. So these are 2018 averages. From what I understand right now, it's not, the amounts aren't changing for OW and ODSP recipients with COVID-19. The OW and ODSP recipients will remain the same. There will be no interruption of the amounts that they're getting. There's going to be no stops. So if you have clients that say something's stopped and they haven't received it, you need to encourage them, or if it's you yourself, you need to encourage them to call in to the local office. You'll be redirected, but call in to get the amounts put in place. Nothing at this point should be ceased. They're running it without stopping. So CPP disability, that's the amount. Depends on what you've contributed. And again, it's a calculation. There is a tool on the website, and you can kind of look and figure out what approximately you'd be receiving if you want to do that. Okay. The other portion, when someone gets the age of 65, and ODSP is a program that runs to the age of 65, they have the opportunity to access old age security and the guaranteed income supplement. Again, this is a federal government supplement. OAS is automatic. Everyone over the age of 65 has it, so you don't need to have an application or special sign up for that. The guaranteed income supplement, this helps the persons that were on the ODSP program. You do need to meet a few eligibility requirements to apply. So one, it has to be low income, and there's a calculation for that. And your taxes need to be completed. So I always encourage persons that are receiving these government, whether they're federal, provincial, to have their taxes completed. One, to receive the GST, which is added income. Two, so that you can access some of these other supports. And now more than ever, three, with COVID-19, there's quite a number of added amounts that are going to be given out to support people with, like, the child benefit, such that the Canadian child benefit, things are going to be increased. The GST portion of funds is going to be increased too. So anyway, those are the two ones that take over for ODSP. Usually those two together offer you a little bit more money than ODSP gives you. So it's nice to know. This is what the calculator and what it looks like on the government website. Okay, so you can see if your household income is a certain amount, this is approximately what you would receive for your old age security pension. Okay. The next portion is looking at, and we always, once we work on the ODSP application with clients or their CPP disability application, is look at other federal grants and bonds that are offered. Okay, so the disability tax credit is something that is there with the government. It has a different definition as well. It's very specific. So if you meet the eligibility requirement for ODSP or for CPP, it doesn't necessarily mean that you're going to meet the requirement for the disability tax credit. It's a smaller application. It's completed by a physician. There's a list of persons that can sign off on it. It is a non-refundable tax credit, okay? It can be given to someone who's supporting a person with a disability, so you can direct the funds, or it can be given to the person themselves, okay? So it helps the person with their taxes in the deductions. So if you are approved, and I always encourage people to try to fill out this application as well. If you are approved, you're able to open a registered disability savings plan. And this is what is helpful for persons with a disability to be able to save money. The government has recognized that persons without a disability are able to save through RRSPs, or are ESPs for their education savings plan. And they've realized that, hey, it's kind of not fair that if you have a disability, you have to remain poor, that you have no way to save at all. So they've allowed for this, okay? The definition is slim, like very narrow for disability, but it's something that the federal government offers. So again, I encourage everyone to try. Because it allows you to access more funds, okay? Another thing to note is that if you do have more than one person in your household and they're earning funds, so some people are in a situation where they don't have a lot of funds and they are relying on Ontario Works or ODSP for their income. There are other people that may have someone in their household that's working, spouse, partner, mother, father, such as that, that does make a significant amount of money. However, they can still apply for disability tax credit to open up the registered disability savings plan for that person within their household. That being said, if there's a lot of funds there, they do need to, and I would encourage someone to speak to a certified financial planner. It's important so that they can look at how to best maximize the outcome of this particular tax credit, okay? I can't do that because I'm not an accountant or a certified financial planner. I just know where to go. The other portion is to talk about is with the RDSP. It does help build for your future. It is like a little retirement savings plan, which is hard to do if you're on OW and ODSP. There's not a lot of money left over. So this is a way to have savings. But there are rules. So I've listed them right there. There's a 10-year timeline. So if you are putting money into this savings plan, you have to wait 10 years for it to be able to pull out some funds if you need them. That way, whatever contributions the government makes, it'll stay in there, right? Okay. There's also a maximum limit of $200,000 that you can have in there. So again, if within your household there are other earners, it's good to talk to someone who understands the financial planning. Okay. So the steps. You apply for the disability tax credit. If you are approved, you open up a registered disability savings plan. Once you have that, then you are able to access the grants and bonds from the government, okay? So the one is the Canadian Disability Savings Grant, and then there's the Canadian Disability Savings Bond, okay? The bond, the government contributes funds. There's criteria for that. There's age limits for that. The grant is where you get to contribute your own monies, and then the government will match it. So there's some matches that are up to $3, $2 for every dollar you contribute, and some that are $1. It depends on the amount. It depends on when that you're making a contribution. Okay, so with why it's important, especially for for everyone really to apply, is because you have that savings ability, but also for those that are on ODSP, for the most part, this is they don't consider that part of the $40,000 asset limit that are part of the Act. There are obviously different circumstances, and I would direct someone to speak to a lawyer regarding that deals with disability tax credit. If there's issues with certain settlements, things like that, so that everything works out so that the client can maximize the benefit in the best way possible and have savings for their future. So it's good to know that there are other resources for people to access other than like financially, other than just Ontario Works ODSP, but each level, whether it's CPP or CPP disability or the disability tax credit. Each level requires an application, and that's where it gets a little daunting. But I encourage people to go through each step over time so that they can access as much of the supports that our federal government and our provincial government have put aside for persons with disability. Okay, if there's any questions, I'd be happy to answer. We do, if there's issues, or if you have questions about certain resources or future questions, please let us know. If you're going through the process of an application and you're getting stuck or having difficulty, whether it's a communication need or some memory supports, or actually physically filling in an application, let us know. We can help. We've provided the number there on the screen for you, because we know that sometimes these processes are complicated. Okay. All right, thank you. You might have to unmute you.
Yeah, so everyone, again, just a reminder, at the bottom of your screen, you'll see a black bar, and there's 2 little boxes. It says Q&A. You can click on there, and you should get a prompt to put in a question.
There's a lot of talking. You can drink some water.
So you did a really good job explaining everything. So that's maybe why there's no questions coming up. That was really well done.
Thanks. Oh, question. Oh, the BIST number again. So I'm going to pop it up on the screen if you're able to see it there. Let's see. Can everyone still see my slides?
Yep, they're still up there.
Okay. And do you want me to type it in?
I think you just answer it live. That's how it works.
All right, so the info line there is 416-830-1485, unless I've said that wrong.
The right one.
Yeah. So if you need to call there, that's for a resource.
Okay, so Victoria says it's very useful information. She would love to receive a recording of the session. So yes, Ryan and I are going to work on the recordings tomorrow, and we are going to email them out to all our members and then put them on the BIST website as well.
Okay. And I believe the slides are going to be made available as well for persons. So if they'd like to access the information in the written format, you can see that as well.
So Helen's asking, where do you find the form for DTC, Laura?
Okay, it is on the government website. Okay, so you have to go under the Canadian government website. If you put in a search for DTC or disability tax credit, it'll take you to a link, and on there will be the application. Yeah, so that the disability tax credit, CPP disability, you can pull the applications off government website. Ontario Disability Support Program, you cannot pull the application off. You have to request that. So that at least for the disability tax credit, you can find it. Something just to share as well, with disability tax credit, doctors are not, some doctors, some physicians are filling it out. However, they're not compensated. With ODSP, they're given a code where they are compensated for their time for filling it out. With disability tax credit, you may find that they may ask for a payment. Some physicians are asking for $50. Some might have a little bit more. So just be aware that that cost may be incurred. If you are incurring that cost, hold on to the receipt, ask for a receipt, and you can submit that with your taxes for reimbursement. So they recognize that that is a cost to you. I wish it was different. I wish that they didn't have that as a barrier, but that is there.
So Laura, another one of our members is, he's applied for a CPP disability and is now in the process of applying for DTC, and he's just saying he may need some more help. Do you mind reminding everyone how you can get help, either through BIST or?
Sure. So with the disability tax credit, I'm glad that that's the second stage, because it is a different funding resource base. If you've got the application already, great. If not, you're going online to the Canadian government website, Canadian Revenue Agency. You're pulling off the application. You're bringing it into the physician to fill out, and you're mailing it to, on the last page of the application, it'll tell you where it needs to go. If you need support with filling it out, you could call us at BIST and we can help direct you. You know, depending on where you live, we can also help set you up with the service provider in your area if you require something a little closer. So does that answer it, or if not, let me know and I'll try again to answer it.
He says, yep.
Okay.
Great job. Another question. Do you have any statistics on how many people with TBI are actually eligible for ODSP and how many have successful applications?
I don't have statistics for something as large as Ontario. I know Melissa might have statistics on the number of brain injured persons reported in the province, but as far as Ontario with brain injury on ODSP, no, I don't have that stat. For our program though, the persons that I've been able to support with applications where we've helped them write out the different conditions and document the examples, we've had each application we've submitted has been approved. So there's good outcome if we're recording the information and the conditions down correctly, with plenty of examples from the participants, from the persons with the referral number, from our clients, and helping support a well documented application. It's been approved.
Okay, there's another question here, but I'll answer for you here, Laura. Victoria, the info series is running, well, there's this session and there's one more next Monday that you can still register for and participate in. But we will be posting a link to all of the slides from each presenter throughout the series. You'll find it on our website, hopefully sometime soon. Melissa and I will be working on it tomorrow. But check our website, and if you don't find it on there, you can contact me directly and I'll get them to you. And another question for you, Laura. If I already have a retirement savings plan, is it better to get the disability retirement savings plan or just stick with my work's retirement saving plan?
Okay, that's a pretty specific question. If you already have like our RSPs or something like you're given a like almost like a pension from work, right? If you can apply to the disability tax credit and it opens up an opportunity for you to access the grants and bonds from the federal government, you might potentially be able to access both. The specifics of that and how it works with your work, I would be taking that question to a disability tax credit lawyer. And a lot of times they'll consult with you the first time for free. I'd also take it to a certified financial planner because they know the ins and outs with the funds. It's a question to ask because especially in a household, if there's multiple people and a lot of funds, you really want to make it work to your benefit, right? A lot of the clients I'm supporting right now only have financial access with Ontario Works and ODSP. So their income is very cut and dry. It's either the basic support income or slightly augmented. But if there are other finances or monies coming in, then you need to talk to someone about how that looks. You still have to meet the definition of disability, right, through that particular application. So, but it might give you a tax break. It might be able to save you, or thousands of dollars in tax savings. So it's worth it to talk to someone about it.
Awesome. We have one more. How long does the ODSP application take from start to finish? If you need to get a lawyer involved, and how does that happen, and how often?
Yep, sure. So once you contact and you go through the financial eligibility portion, the requirement, once they say, yeah, you are financially able to access this particular support, here's the package. The person has 30 days. So really, if you're looking at 30 days with the application, 30 to 60 of it being submitted and reviewed by the disability adjudication unit, you could be up to, at that point, you could be up to 4 to 6 months and it be approved, and then you're getting it. Again, if you have the documentation, if you have a physician ready to sign it, you can have it filled out within a couple weeks, submitted and approved within a month or two. Okay. Right now, I'm not sure what their personnel is with COVID-19 and whether there's issues with people being able to review the documents or whether they've shut everything down for 2 weeks and then will respond at a later date. But you're looking at that. If there's a denial and you're going through the process of internal review and the SBT, which is the Social Benefits Tribunal, that process there is taking many months. So 30 days for internal review. You have another 30 days to get the document signed and in to access a Social Benefits Tribunal. That's a 60-day process. And then Social Benefits is then booking sometimes 6 months to a year. So if you're denied, you might be looking at 6 months to 12 months to go in front of a adjudicator to kind of plead your case. That's generally speaking enough time to contact a lawyer. If you're eligible for legal aid, contact legal aid. If you have the funds and can contact a lawyer that deals with the ODSP, that's great too. Contact them. They'll know the ins and outs, especially if there's other finances involved. And yeah, so you could be looking up to, 2 to 4 months in the initial process if it's approved, great. And then could be looking up to 6 to 12 months if it's denied.
Awesome. We have one more question here, at least for now. This is in regards to one of the previous questions. Just asking again what the type of lawyer was called that you recommended for DTC, and if you have any recommendations for lawyers.
Okay, so the recommendations are pretty broad, and I mean, it really depends on where you're living, where you're located. We always say at BIST, please Google the top 5 best lawyers in your area, because you want to look at the ones that are up there and have been ranked and have credible supports in your area. For the disability tax credit lawyer, when you're looking, you're going to see someone who works with, they'll indicate that they work with disability tax credit, ODSP, okay, and other financial supports. If you have right now, a lawyer that's with a claim that's open for, say, a motor vehicle accident, and you're working with a lawyer currently, I would contact them, because they might be working with someone currently that they would support and direct you to. There's lots that offer some good advice and great supports. I can't give a very specific name right now. I'm just going to add this because this is what we do at the office sometimes. With lawyers, if you're having difficulty calling them, we do offer support where we would help you formulate the questions. We would help you make the call and kind of pose your question to the lawyer if that's something that you find daunting or difficult. Sometimes that's the support that a person requires. So we've done that before.
Awesome. It doesn't look like there's any questions lined up. I'm just going to check the chat quickly. Oh, another question just came in. There's nothing in the chat. So you mentioned another a couple times programs. What's happening this Wednesday? Oh, you don't see it on the, okay. So this website this Wednesday, Victoria, we're still having our community meeting. It'll be a webinar similar to this, but specific to strategies, some tools you can use to manage this period with COVID-19. If it's not up there now, it should be very soon. Again, if you don't see it by tomorrow, please contact me directly and I will get you the information. This is a great question from Helen. What about legal aid for ODSP applications?
Yeah. So in your area, depending on where you live, you would look for the legal aid office that supports your postal code. Okay. If you require support, that would come after a denial. Okay. You would call and you would be directed to a legal aid ODSP lawyer. So it is based on your income, based on your finances. So if someone isn't able to access a lawyer and doesn't have the funds, then they would call legal aid and they would set you up. So we've worked with quite a number of them when someone's come to BIST with a denial and they don't know what to do, and we've walked them through the steps of the internal review and walked them through the steps for the social benefits tribunal and getting the paperwork in. The legal aid office can help with that. Yeah. So and they'll help you with getting the signatures on the page, faxing it in, and then receiving the correspondence from the tribunal about the date and such. They also are there depending on the case. They would meet with you and assess whether they would proceed to represent at the trial. There are times when they don't, but generally speaking they do, but that's up to them to decide. And we've walked people through that process. We've also sat with them when they've met with their legal aid lawyer, just so that we can be a support, a physical support for their maybe managing some of maybe their anxiety, but also we've taken notes for clients as well, so that they are going home with something, whether it's follow-up that they need to do, or accessing documents, finding documents in the community from hospitals and that. But yes, legal aid is there for persons that require it to help at the social benefits tribunal state. And they go to the adjudication. It's in a room, much like a boardroom, where you're sitting around the table. You have an adjudicator. Sometimes you go in and they have another representative there. If you have a lawyer, sometimes it's just the adjudicator, and it's just you and them. Sometimes you're allowed to bring a support person the support person is not allowed to talk or answer any questions. And other times you can bring a witness, and that witness would have to wait out of the area and only go in when they're called. So.
Awesome. Yeah, great question, Helen. It looks like the Q&A is empty. Might just give it another minute, see if anything else comes in. And again, checking the chat. No questions in the chat right now. So yeah, we'll just give it another minute, Laura.
Cool. Yeah.
I'll just quickly thank all the attendees, everyone, for sticking around and asking Laura these questions. They're fantastic questions, and yeah, hopefully you really learned something from everything she has to say. Laura is a fantastic resource, and it's really difficult to appreciate, you know, in an hour presentation, just how much knowledge was shared. So thank you, Laura, for giving us your time.
Yeah, anytime.
Awesome. Thank yous for Laura.
Well, it's my pleasure. If I have ever, I always say when I have information, I always will share it. I think resources and resource sharing is vital to our community and vital to people being successful. So.
Yeah, that looks like it might be it.
Good.
Did you have any last thoughts, Laura, Melissa?
I was just going to say thank you, everyone, for joining and listening. It was great.
Thank you again to Laura, and thank you again to PIA Law for coming out and also for supporting us in this event. We can't do the work we do without you, so thank you.
Yes.
Thanks, guys. Thanks for a great chat, Laura.
All right. I think I have to end the meeting, so I will log off. Thanks, everybody. Stay safe, stay well, stay healthy during this time. Take care.
Bye.
Bye.